Hi, our country is Uganda, and we are going to be talking about the healthcare system. I'm Alexandra Berry.
I'm Bailey Smith.
I'm Ashley Waldron.
And I'm Brianna Youngs.
Some background on Uganda is that it's a landlocked country in mid-Africa. Its capital is Kampala. This shows the capital city with the remaining regions of Uganda being very rural with a population of 42.7 million. This shows the diversity of the land in Uganda. Some facts about Uganda is that the main language is English and Christianity makes up most of the population. It is also one of the poorest countries in the world.
Uganda's healthcare system is made up of both private and public health sectors. According to the World Health Organization, it is estimated that around 50% are private and the other half are public. The Ministry of Health oversees both private and public healthcare facilities and governs them. Some examples of private healthcare facilities are village health centers and some hospitals. Village health centers vary in quality of care as well as what services can be provided. For this reason, different levels of care are given to each village health center, similar to how trauma centers are given levels of care based on services they can provide in the US. Uganda as a whole lacks much preventative care, and healthcare is usually only sought after once people are sick or in an emergency situation. This image from the World Health Organization shows how the healthcare system in Uganda is broken down by administrative hierarchy, the service provision hierarchy, and health subdistricts. Here you can see in more detail the various levels village health centers can be given based on the services they offer. For our project, we interviewed Robert Smith, who frequently visits Uganda and has had experience with Uganda's healthcare system. In our interview, Robert talked extensively about the village health centers, which are mostly privately owned. These health centers also provide 24-hour access to care and have relatively short wait times. The care received is not free as it is a private health clinic, so most people pay out of pocket. The quality of care varies from clinic to clinic, but the locals can easily tell you which clinics provide better care. Robert also talked about the private hospitals in the capital city of Kampala. These hospitals have long wait times but offer more services and provide a better quality of care.
According to the World Bank, in 2017, Uganda spent roughly 6% of their GDP on healthcare. In Uganda, healthcare is financed both publicly and privately. Overall, Uganda's healthcare system is primarily funded privately through out-of-pocket payments for services and not-for-profit organizations. Around 24% of the healthcare system is funded publicly by the government through the collection of taxes and foreign aid. Uganda's government implemented the National Minimum Health Care Package to all its citizens. The health care package focuses on four main categories: health promotion, maternal and child health, the prevention, management, and control of communicable and non-communicable diseases. Uganda's government does not provide enough funding for the National Minimum Health Care Package, so many citizens fall short from receiving necessary care at no cost. The elite are the only ones who can afford private insurance, which is less than 5% of the total population. They're public and private health facilities. The wealthier population with private health insurance can access private health facilities that are at higher quality compared to public health ones. The rising out-of-pocket costs and distribution of healthcare providers causes large gaps in care throughout Uganda. 80% of Uganda's population, around 34 million, live in rural areas. However, most public health facilities are located in urban areas, leaving millions of citizens to travel far distances to receive adequate care. In Uganda, the long referral system can cause citizens to need 2 to 5 referrals to get to a facility that they can perform the proper treatment. Another issue with the large gaps in care is the distribution of medical providers. The majority of medical doctors, dentists, pharmacists, and nurses are located in hospitals in urban areas, leaving allied health workers, traditional healers, and volunteers to care for citizens in rural areas.
In general, Uganda has poor access and quality of education. For healthcare training, there are 61 institutions with 5 medical colleges, 27 allied health training schools, and 29 nursing schools. They lack sufficient medical faculty and equipment, which results in poor training because of limited resources. Only 35% of public health workers could correctly diagnose at least 4 out of 5 common conditions, such as malaria with anemia or diarrhea with dehydration. This shows a lack of adequate education. From 2010 to 2015, out of 2,915 students, only 72 Ugandans returned to Uganda from medical school training abroad. an average of only 12 annually, leaving them depleted of quality providers. This is a picture of the best ranked teaching hospital, the Kampala International University, with the only accredited dental program. This next picture is of the Uganda Christian University Medical School, which is a nonprofit school. The next picture shows a medical laboratory training school in Uganda. Uganda faces a significant shortage of trained healthcare professionals, especially in rural areas. As a result, the Ministry of Health has been supporting them by delivering village health teams that have basic training and stay in communities and provide their services voluntary. This picture shows a village health team meeting. They're also planning on creating a program called Community Health Extension Workers that are paid as healthcare providers who are trained for a year and have elevated skills. However, a majority of people don't seek medical care, and family members tend to be the caregivers with little knowledge. This picture shows the poor working conditions that they have and also how family are the people that provide medical care.
The culture in Uganda has a wide impact on healthcare. The man is seen as the head of the household while the woman is seen as the caregiver. Because of this, the woman must seek permission in order to obtain healthcare. Religion also has a large impact. The main religion in Uganda is Christianity. Some healthcare treatments are avoided by those involved in more strict religious groups because they are considered sinful. HIV is the #2 cause of death in Uganda, and condoms and HIV treatment are frowned upon by religious leaders due to the lack of abstinence. Also, many people partake in traditional healthcare treatments such as the use of herbs, meditations, and other practices. The average life expectancy for males is around 62 years old, and the average life expectancy for females is around 64 years old. Over the last 20 to 30 years, average life expectancy in Uganda has risen by nearly 20 years for both males and females. Uganda's burden of disease is dominated by communicable diseases, which account for over 50% of the morbidity and mortality rates. There is also a growing concern for mental health disorders in the country. Tuberculosis, HIV/AIDS, malaria, etc. are all high causes of death in the country. The photo shown is a covering placed over the children's bed at a local orphanage to prevent mosquitoes from entering and spreading malaria. COVID-19 has been prevalent in Uganda, and they have taken many precautions due to the lack of healthcare resources. Maternal mortality rate has dropped over the last 20 years, but their number is still much higher than the US. Population in Uganda is also very malnourished. Many mothers in rural communities give birth in their homes with no medical assistance due to lack of healthcare access or lack of funding, but also because that is something that is considered normal in Uganda. The photo on the right are 2 young children at an orphanage in Busia, Uganda. They were likely there because their mother passed away during birth, and that happened very often. The small baby in the photo on the left is named Christmas. The mother was feeding him Mountain Dew. Mom is HIV positive, can't breastfeed, and could not afford formula, so she just fed him whatever she could get her hands on. This is a video from an interview with Robert Smith, who visits Uganda frequently and discusses his experience.
Not really sure about the education level of the people that work in the clinic, but for instance, to treat me when I went, I had, diarrhea and vomiting. They were afraid that I had malaria, so we wanted to go and make sure that I hadn't gotten malaria. And so we went in, they poked me. Not sure if the needle was reused or not. Didn't see them get a new needle, but put my blood on a slide, and then they looked at it under a microscope. So, and that was the extent of how they diagnosed what was wrong with me. I think they prescribed something and or said that they tried to say that I had something, but it didn't make any sense to me, and I ended up not taking anything. So
thank you for visiting Uganda's healthcare system with us.